Welcome to another episode of Health Matters with PA Lynn Szabo. My name's Heather, and what are we going to talk about today, Lynn?
I'm doing my yearly commentary about how to survive COVID, flu, RSV, and upper respiratory infections. I should have put strep in there too, because this is the season, and as typical, the kids lead the parade, the illness parade in Illinois.
It is time for the nasty children.
Yeah, I just started seeing croup this week.
Aw.
Yeah, and the little ones. And if you know the cough, you know
Yeah,
croup.
that seal bark.
Yeah, that's almost
Unmistakable.
pathognomonic, as we say in medicine. It couldn't be anything else. But I'm also seeing strep in the high school crowd and the young adult crowd.
Okay.
And there's been reports of influenza in the county, but I personally have not seen that. I think that's going to blow up in between Thanksgiving and Christmas and then go crazy after Christmas.
Okay. Is that typical for our areas after Christmas?
Oh, totally. We have two peaks of influenza almost always, and it's, Christmas plus or minus, and then another small peak in April, which is why now is the perfect time to get your flu immunization, because you need it to last 6 months all the way to that April bump. So if you've been holding out, now's the time. And COVID remains a thing. Lots of COVID since the fair, kind of little peaks and then it kind of calms down for a while. But we're expecting a wave in the winter, so now's the time also for rational healthcare to include updated vaccines for COVID as well. And some people, especially over the age of 60, also have the option of getting RSV immunizations. Pregnant women it's not really an immunization, it's an immunoglobulin for pregnant women, immunization for elders, and infants. And this has been a well-received immunization, really helpful.
For infants, for RSV?
Yeah, for RSV in their first and second years of, I guess, the outbreak. And supposedly it's dropped the amount of RSV by 80%. And I don't know if that number is here, because I still see plenty of it, and there's a lot of sick kids, or if that's like nationwide or California. They don't really keep statistics anymore, because if you don't count the numbers, it's not a thing, I guess.
Okay.
But
That's just sad.
it is sad.
With the West Coast Health Alliance that's now been formed, will we have access to that information again to know in our area?
Well, the
or is it
American
just-
Medical Association has been publishing a lot of the stuff that the CDC hasn't. But the flu map, which I find the most helpful for influenza, remains active and hopefully accurate. But if you're not testing for it, it's kind of hard to understand.
Gotcha.
So go to the AMA if you want good information.
Okay.
Okay. Or you can call our local public health branch.
I love our local public health.
I know those. Well, I communicate a lot with the nurses. They're very nice, very helpful.
Very knowledgeable people.
Mm-hmm. And they also speak Spanish.
Wow.
I don't know if there's a Hmong speaker, but expect to be able to communicate if that's a language that would be easier for you.
Okay.
So immunizations, I noticed, they're offered at the public health department and the pharmacies, but UHS has also been advertising flu shots on their website, and they have not had any restrictions as to whether it's for the Native community or not. And if they're following the precedent that they set with COVID, they immunize their elders and healthcare providers first, and then they open it to the community.
Okay.
As long as they have access to the vaccines.
Yeah, I remember through COVID, whenever I needed testing, I would go to the local tribes, and when it was time to get vaccines and things, that's where I got mine, and they filled out the cards. Was at the local tribes.
Yeah.
Yeah.
Super helpful.
It was an incredible service to our community to have that.
I spent the whole year giving out COVID immunizations at various sites through the county, and so I saw a little bit of everything. And what I did not see was, I think I saw one response in a very sick elder, and then everybody else did great. Mostly there was anxiety about it, But, after people were getting them and doing okay, there wasn't much fear anymore.
Yeah.
Yeah.
And I was definitely one of those ones that was, I'm not getting it. I'm not getting it. I'm not getting it. And then it was just like, nope, I'm going to go do it today.
And it's best, so insider tip, and I've said this before, it's best to get your COVID shot at the same time you get your flu shot. It's not going to make you sick. It might make you uncomfortable with a good immune response, but that's something to be happy about.
Now, if you can't get them both at the same time and you have to get like a flu shot one week and then the next week.
No, you should get them at the same time. Your immune system can completely handle it. And if you, for reasons that they don't understand, people who got flu immunized did better through COVID.
Okay.
And people that got flu shots the same time they got their COVID shots, the COVID shots seemed to work better. And they don't know why that would be.
Okay.
And if you have a dedicated COVID arm, like my COVID shots go in my left arm, then somehow that seems to make them last longer. So nobody knows why. There's no obvious logical reason for that.
Nice. Well, the reason why I ask is I had a friend of mine tell me that they tried to go to the pharmacy to get their COVID shot, and because of their age, they were told that they're not old enough to get it. So they just went ahead and got their flu shot and then tried to work it out. So because they were telling her because of her age, so she couldn't get the COVID vaccine at the pharmacy. It wasn't available to her. It wasn't here at our local area. It was outside of our area. So she just went ahead and got the flu shot. So when she has access to the COVID vaccine, is it okay to do it then?
Well, I suspect it wasn't that she really didn't have access. I suspect it was that they were going to have to charge for it, and they didn't want to do that.
Oh, you think they just say, well, we can give you your COVID vaccine today, but you have to pay whatever amount for it.
Yeah,
I don't know. I don't know either.
Yeah.
Okay. So do them both at the same time?
Yeah, do them both at the same time, even if you have to go to the public health department to get them both at the same time.
Okay.
Okay. So lessons that we should review. So COVID, influenza, respiratory syncytial virus, which is RSV, these are all viruses, and they are not treated with antibiotics.
Okay. I wish you guys could see.
So I got the question yesterday by a grandfather who was taking care of 2 children, and he was just certain that if I could figure out the right antibiotic, that his kids would not be sick, but they both obviously had the croup.
Oh, no.
And then he went on if we give them the antibiotics now, then they won't get sicker, which doesn't work.
It doesn't work.
No, it doesn't work. And then he went on with, if we give them the antibiotics now, then we can keep their grandmother from getting sick, which doesn't work.
How? I don't even understand the logic in that one.
I think it comes from a place where people just want to be better, and that this is something that they have noticed makes them better, so it must be the right thing to address every illness they have.
Gotcha.
Yeah. So it's not medically rational to take antibiotics when you have a viral syndrome. And these illnesses, there's a joke in medicine is without antibiotics, your cold is going to take 2 weeks to get through. And with antibiotics, your cold is going to take 2 weeks to get through. So it's not going to change anything.
Now, is it 2 weeks of feeling miserable, or the 2 weeks to go back to feeling like you were before you did get sick?
Going back to baseline. So you're probably miserable the first 3 or 4 days.
Okay.
Depending on.
And then the cough's gone, and the extra mucus and all that other stuff is gone by the usually 14 days.
Uh-huh.
Okay.
But here's the deal. It takes your body 1 year after antibiotics to regain your probiotic balance.
Oh, no.
So 1 year to go back to optimal probiotic. I mean, assuming that you're actually achieving it, or at least as optimal as you can. And, I noticed with a lot of people that they just got off antibiotics, like for a cold, about a week ago.
Jeez.
So they're probiotic balance is kind of in havoc.
Yeah, and isn't the probiotics in your gut health, right? Isn't that important for your immune system to function?
Super important. Intestines, especially small intestines, are part of your immune system. Who knew?
Well, you knew.
Yeah.
And the small intestines, those are the ones that are up at the top, right? And then your large intestines.
No, the small intestines are in the middle, and it's kind of like large intestines do a half circle or a 3/4 circle around.
Oh, okay.
Yeah. So the other thing that needs to be said is the cold and flu section of the pharmacy or the grocery store is filled with medicine that has no intention of curing you. And
can you cure a virus?
No, you have to wait for your immune system to take care of it. But people have the expectation that if they buy an over-the-counter cough medicine that it's going to have a curative effect. Those are solely comfort effects.
Okay, so are they effective on the symptoms? So if you have a cough, will the cough
for a short period of time and comfort? It's not going to make you better faster. You still got 2 weeks of it to go into.
Okay.
So it's a mistake to use them for getting better. The best they can do is offer comfort measures. So patients are always disappointed when they say, well, I've been taking, brand X and I'm not better yet. Well, you're not going to be better. The next sad thing is that almost all of those medications are different combinations of the same 3 or 4 drugs.
Oh.
So you really have to read the active ingredient list to understand what you're actually getting. A lot of them have unnecessary drugs in them, and a lot of the drugs that are in cold medicines don't work. And they can cause, things like elevated blood pressure in some people or other problems. So make sure that you read the active ingredients list. You don't really have to understand what the active ingredients are, but you should be able to know that the box in your right hand and the box in your left hand have the same ingredients at about the same dosage.
Okay.
So they're the same stuff.
So just buy the one that's cheaper?
Yeah, that's what I would do.
Okay.
And then the other thing is most of those ingredients in there don't necessarily help. And some of them, like phenylpropylamine, can hurt people with stroke risk and things like that. And so they're taking those out of them.
What is that?
Phenylpropylamine is a decongestant, and for women of a certain age, which would be us, it can increase stroke risk.
Okay, that's not good.
Yeah.
What is there a brand name that comes in? Is that like?
Almost all of them. Oh. So I personally, when I'm reading the active ingredients list, I don't buy anything that has phenylpropylamine in it. And pretty soon it's not going to be a thing because it's going to be taken out.
Okay.
So it's a Sudafed-like drug.
Okay.
Okay, if we have to use the brand name, it's not the exact same thing that's in Sudafed, but it's similar. So it's a nasal decongestant, but it also makes your blood pressure zoom up. And the other problem with those meds in the aisles is that they don't do anything for kids. Okay?
Okay.
And so parents always want to know what's going to keep my kid from coughing through the night, because parental sleep is a huge important thing.
It really is.
And actually for kids,
that's important for them too.
Sleep is medicine. We have to start looking at sleep as medicine. But there is nothing that you can buy over the counter that's going to help kids with cough, for example, except for honey. That's the only thing. And I recommend honey after the age of 2, because less than that, then they have a risk of getting botulism from it. And, adults, if a botulism spore is in a teaspoon of honey that we're taking, our body, our great immune system, and our small intestines can take care of that.
Okay. Now, so I have family members that with their little ones, they do the elderberry and honey. So they'll either make it their own, make an elderberry and honey syrup for the extra vitamin C and for the cough suppressing of the honey. Is that effective, or is that just, again, that's just comfort because...
I think that's more comfort.
Okay.
And you wouldn't use that on a kid less than 2 years old.
Yeah, no, it's like honey. The 3 and 4. Well, actually, even some of them give them to their 10 and 12-year-olds too. So when they have a cough.
So what do you do for cough for a kid? Well, hydration, steam, rest. What I recommend a lot is a humidifier instead of a vaporizer. I don't like putting like scented chemicals and stuff in a vaporizer because I think that actually activates the cough mechanism. And then the other thing that's helpful that I recommend is postural drainage, which is medical talk for if your kid's sleeping in a little bassinet by the side of the bed, then what you do is you put a pillow under the mattress of the bassinet. And you
elevate their head.
Yeah, you don't want to prop the kid up because especially a younger baby will just kind of roll into a ball down at the bottom. But you just want them to be at a slight angle so mucus kind of goes away from their lungs and more into their stomach.
Okay.
And you might say, well, we live in a humidifier, right? I mean, we went outside today. There's a lot of moisture in the air. But I think it's important to actually have it in the room where the child is sleeping. And that
so go back to doing what our moms did for us when we were little with a humidifier in the room and like the Vicks Vapor Rub on our feet and
you can go ahead with the Vicks Vapor Rub, but then that also kind of smells, and that can be, if a kid has asthma or something, that's going to trigger cough.
Okay.
So, chicken soup has some data to suggest it's antiviral. So
I always just thought it because I was keeping you hydrated.
Yeah, I think that might be, but I don't think they actually know that yet. But be careful about hot soup in a bowl on a kid's lap because that is a well-known common catastrophe in the ER. So be thinking about things like hydration, steam, rest, because this has more scientific ability to actually work. There's more data to suggest this works. Okay. There is no evidence that Tylenol is associated with autism. That needs to be said again and again.
Right.
And Tylenol is useful for keeping kids comfortable during the night. And sometimes, when we're getting the flu or something, when we feel what we call prodromal, those body aches that kind of start, baby, there's nothing to make us believe that a baby doesn't also feel that, and it might be tossing and turning, and a little bit of Tylenol can be super comfortable. If you go online and you buy a bottle of Tylenol in the store, then it's going to say under 2, talk to your doctor about dosing. I would, during a well child check, when a kid is getting immunizations, ask for a Tylenol dosing sheet. So we have information that's not easy to find anywhere else. And if it's coming from your pediatric team, then it's more believable that it's safe.
Oh, good. Okay. That's a good suggestion. Thank you.
Yeah. So I hand them out all the time. We have files of them.
Oh, good.
Pregnant women should speak to their OB care team about immunizations that allow an infant to get passive protections, like for RSV, for whooping cough, for COVID, for flu. Very few pregnant women will go with those immunizations except for the RSV one, because every young mother in this community knows what RSV is, and they know about kids that have been flown out because they couldn't breathe. But the other illnesses are just as deadly for kids. And if this is a passive way to use the mother's body, especially with a nursing mom, use the mother's body to provide protection from the kids, I don't know why it isn't a thing. Yeah. I think it should happen. But like everything else, if you decide not to immunize your child, so if you decide to say no to the immunoglobulins and the vaccines while you're pregnant, and then actually when a child is the right age, you decide not to immunize them, you really have to have a plan B for how you're going to take care of a quarantined sick kid. And that is not going to get unnecessary antibiotics so that you can get to work faster because your boss is annoyed. It's going to mean maybe you're going to be 3 weeks out. So if you're 3 weeks out, what if you have 3 kids and none of them are immunized and the measles comes to town? Could be a real thing. There's measles in California right now, but not Northern California, to my knowledge.
Okay. Well, there's a big outbreak, too, in Arizona-Utah border, right?
Mm-hmm.
Jeez.
Yeah, also on the East Coast, and, of course, Texas and Kansas. And so I think most of the measles in California is centered around Southern California.
Okay.
But for a kid who's even doing okay during the measles, they have to be quarantined for 3 weeks.
Oh, wow.
If you have 3 kids that are all immunized, that means you're going to be out of work if you're... if you work outside the home for a long time.
Yeah.
So 21 times 3.
Jeez.
So have a plan for that. You could miss a lot of work, and vitamin A is not treatment for the measles. Raw milk is no help. And so better yet, it's just better to make sure that your kids are protected and immunized.
It does seem to be the easier way to go.
Yeah, and you could start during your 28th week of pregnancy when you get immunized for tetanus, diphtheria, and pertussis, which is AKA whooping cough.
Okay.
So it's also kind of difficult because people always want notes. I mean, totally well people who were sick last week will come into the clinic and need a note because they missed school. Either their kid missed school or they personally missed work. And that I wish the employers would lighten up on that, because it's ridiculous to charge somebody that kind of money, or the insurance company gets charged that kind of money for a note. I mean, how do I know? I didn't see him last week. I don't. Maybe we're addressing the fact of are they safe to go back? Well, then the bosses don't like the answer anyway.
No.
If somebody's had COVID. So
yeah,
I wish that wasn't a thing.
I think it's to prove that they were homesick and not. I don't think that the employer is asking if they're safe to come back to work. I think that they're making you verify.
It doesn't really prove anything if I didn't see them during their sickness.
Yeah.
What do I know? I just write what they tell me. And
that's just really unfortunate that we require that of our labor force.
It's ridiculous. Why don't we just all be grown-ups? So that, I believe that Sutter Coast has their walk-in clinic on Sunday, is what somebody told me.
Okay.
You might want to check that. I think Stellant is open on Sunday too, but not Saturday.
Stellant just sees its own patients, though, right? Or do they have a walk-in clinic?
Well, anybody that walks in kind of. They hope that's an opportunity to absorb them into their practice, but
okay.
It's the assumption is made you're changing to Stellant as a primary care person.
Okay, but on Saturday, just Open Doors Clinic, you can just walk in and you don't.
That's me. That's the no rules clinic.
Okay.
You don't have to worry about who your primary is.
Is the Sunday clinic for Sutter that way too? So as an open door patient, you can walk into the Sutter clinic on Sunday because everywhere else is closed?
I think so.
Okay, that was my understanding as well. I wasn't sure
I do
about
think
Stellant's.
so. Do you know what time it is? I know my Saturday open door clinic is 10 to, we lock the doors at 1:30 so we can kind of wrap up. But we're seeing a good number of patients and we're not even really deeply into the season yet. So
wow.
Saw 17 yesterday.
Oh my goodness.
And most of it was upper respiratory infections.
Oh, so that's going round.
Yeah.
I'm glad I got my flu and COVID shot
I know.
already.
I got my flu and COVID shot too this past week, and I didn't feel bad. I felt like I'd been immunized, but I didn't spike the fever I usually do. They now have a shot, both flu and COVID, for people over 65, which is me.
Okay.
And I felt like it was better tolerated.
Okay.
So I was happy about that. So, so there's been on KFUG we're going back on the air soon, and
yes.
There's been, that's been open about Facebook. Really looking forward to that. But I think that it's also going to open up Health Matters to different medical guests from the community. And I wanted to specifically mention Ryan Butler, who wants to talk to me about counselor burnout in the community. He's kind of starting a support group and is addressing it, which actually might, we'll see what he has to say, but that might be one of the problems in getting access to counseling in this community. So I'm really looking forward to that. And that's going to be sometime in early November, one of our first 2 Novembers. And then I have a couple of physicians who are interested in talking about their specialties.
Oh, wow. That's cool.
Yeah, super cool. And then,
what specialties?
Cardiology is the one that comes to mind, and we don't have a cardiologist.
We don't have a cardiologist
in this community. There's cardiologists in Humboldt that are really impacted and hard to get in to see, and then also Southern Oregon Cardiology has their satellite clinic in Brookings.
They do,
which we should ever be thankful for, but that might be difficult for somebody who has insurance that limits them to California.
That's true. So anybody on covered California is limited to stay within the state for their providers.
Yeah, right. And I think that the time it takes to get an actual appointment with a cardiologist in Humboldt County is some months.
It is several months to even get into, oftentimes to get into Southern Oregon Cardiology.
Right.
It can take 2 to 3 months.
Right, especially their Brookings outreach, which is very popular, I'm told.
Yes. So. I think my understanding is that's kind of limited to the number of people they can see when they come here too. So.
Right, totally. So, we can talk about another huge need in this community.
Yeah.
Yeah, super exciting.
Maybe you can convince the specialists to move here.
Well, they could... There's outreach communities, for pediatric cardiology. Dr. Stanger took care of the Eureka community for decades. And, he's still, he's retired now, but he still manages to show up and take care of his kids every once in a while. You can never really leave it behind. But to have a dedication as an outreach provider to a certain community because you're aware of the extent of the need is incredible.
Yeah.
And so I know with my recent ankle surgery, I went to Southern Oregon orthopedist. Thanks, Dr. Owens, for fixing my ankle. But now that they know who I am, although I don't think that carries any special weight, but I have talked about what it's like to do medical care in Crescent City and how much we appreciate their help and Absolutely. How much we would love it if they could consider an outreach clinic also.
Yeah. And my parents were patients of Southern Oregon Cardiology for decades. I remember Dr. Personius coming in to tell my dad in the hospital that his sextuple bypass had finally failed after 12, 15 years that he'd done it. Right. He brought his son with him because he'd known my dad for so long and knew us kids and the grandkids and just the amount of love that he had, that it was so genuine. So I'm glad you're going to talk about provider burnout. I do think it's a real thing. Thinking it back to my parents and the people who cared for them for so long, the effects that their illness had on them.
Exactly.
I don't think, and they have so many patients that they see those things with. I don't think as patients that's something that we think about. So
it's kind of heartbreaking, and there's also few resources, so it's super frustrating. So we'll see what Ryan has to say about that.
Yeah, that'll be a very interesting conversation.
Yeah.
Well, thank you so much, Lynn, for talking to us today about not taking antibiotics when we have a cold or a viral infection, and the importance of that, and the importance of getting our vaccines. And if I'm not mistaken, you do the flu and the COVID at the same time?
Yep.
More effective?
Yep. Have a dedicated COVID arm.
Have a dedicated COVID arm, and Tylenol does not cause autism. So I thank you again for reminding us of that.
Yep.
This has been an episode of Health Matters with PA Lynn Szabo. If you would like to listen to this episode again or any of the episodes that Lynn has recorded over the past 7 years, you can always go to KFUG Radio on YouTube and just select the playlist and search what it is you're looking for. Thanks, Lynn. I'll see you next week.
All righty.